avoid non-selective beta blockers in. Now, you know that beta blockers are usually selective in nature or non-selective in nature. We first of all need to understand that beta blockers means they act on beta receptors, and beta receptors are of three types. We have beta 1 receptor, we have beta 2 receptor, and we have beta 3 receptor. Beta 1 receptor usually causes vasoconstriction, which increases blood pressure. And beta 1 receptors are also found in the juxtaglomerular cells of the kidney, which produces renin that triggers the RAS pathway. So cardioselective beta blockers usually target beta 1 receptor, for example, metoprolol, bisoprolol, etc. And as a result, they stop the starting phase of the RAS pathway, and they also prevent vasoconstriction. So as a result, they reduce the heart rate, and bradycardia is a common side effect seen with blocking of the beta 1 receptor. Coming to the beta 2 receptor, it causes vasodilation. That is something in contrast to beta 1. Beta 2 causes vasodilation, and it also causes bronchodilation. That is why non-selective beta blockers should never be used in patients with asthma and COPD, because unless it is absolutely very urgently required. The reason is that if you are using non-selective beta blockers in asthma and COPD, already in asthma and COPD we experience bronchoconstriction. That is the narrowing of the airways where the patient experiences difficulty in breathing. So there, if we are using non-selective beta blockers, that can further increase the bronchoconstriction, which can worsen matters for the patient. And then we have beta 3 receptors, which usually are found in adipose tissue. I'm not going into the detailed pharmacology of all the receptors. This is just to give you an idea. Beta 3 receptors actually trigger the release of an enzyme called lipase. From the name itself, you should understand lip means lipid, ase means breakdown. So they actually increase the good cholesterol and they reduce the bad cholesterol. So if a patient is suffering from any kind of dyslipidemia or any kind of obesity and has a cardiovascular risk factor as well, and there if we are using non-selective beta blockers, then it can further worsen the dyslipidemia or the CV risk, the cardiovascular risk that the patient might be predisposed to. So to remember the contraindications of non-selective beta blockers, we can remember the code ABCD. First is asthma, as I told you why it is, because it blocks beta 2 receptors. So as a result, it can further worsen the bronchoconstriction. Then we have atrioventricular block. The reason is it significantly hampers the beta 1 receptor, which can cause very severe bradycardia. And if a person is having atrioventricular block, already the patient is experiencing bradycardia. So that can lead to cardiac arrest. And in congestive heart failure also, we should avoid non-selective beta blockers. That is due to a multiple of reasons. Heart failure is a condition in which the heart is not able to function properly. So there significant bradycardia may be seen. And also if the person is having dyslipidemia and that has led to heart failure, in that condition also non-selective beta blocker is not a good option. And the last point, which is actually interesting, is diabetes mellitus. Actually, the reason behind this is insulin usually causes hypoglycemia. And whenever you have hypoglycemia due to insulin, the autonomic nervous system gets activated. And the effect of that autonomic nervous system activation is you experience tachycardia, you experience sweating, you experience tremors and all this kind of things. If you are using a non-selective beta blocker in a diabetic patient, especially if that person is taking a medicine which triggers insulin production, for example, it is insulin, or it can be a sulfonylurea also, because that is also known as an insulin secretagogue. It also produces insulin. So if you are using a non-selective beta blocker in such kind of patients, they will suppress the autonomic nervous system warning. So this condition is a life-threatening condition which is known as hypoglycemic unawareness. So that is why Even if you are having hypoglycemia also, you will never understand that you are having hypoglycemia. And finally, it can lead to life-threatening consequences. So that is why non-selective beta blockers should be avoided in patients with diabetes mellitus, especially if they are under insulin therapy, or if they are under any kind of anti-diabetic therapy which produces insulin or which increases the quantity of insulin. For example, sulfonylureas. Next, we will come to, this is just a short video. So this is a small idea that can give you the drugs that cause SLE. Systemic lupus erythematosus, it is actually an autoimmune condition in which your body's immune system considers your own body as enemy and triggers antibodies against the same. So this is actually applicable for some medicines. For that, you have to look at the metabolism of those medicines. If a medication is metabolized through acetylation, I hope you know biotransformation. We have phase 1 reaction, we have phase 2 reaction. If a molecule is metabolized by acetylation reaction, there are chances of developing SLE as a side effect. So all of these medicines that you are seeing here can cause SLE as a side effect because they are metabolized through acetylation. So to remember the names of the drugs that can cause this, we can remember the code as SHIP. S stands for sulfonamides. Sulfonamides are antibiotics. H stands for hydralazine. Hydralazine is an antihypertensive given in life-threatening situations. And another H that has very recently come, this was actually published in an American Journal of Case Reports. Hydrochlorothiazide have also been found to cause SLE. I stands for isoniazid. This is very important because isoniazid is an integral part of the medication management in tuberculosis patients. And P stands for procainamide, which is an antiarrhythmic as well. It has cardiovascular effects. And you can add, if you want, this is actually, I got it from a book. I just thought that I will add an idea to this. I will make the mnemonic as queen of the ship. So queen starts with the letter Q, and Q stands for quinine or quinidine. They are also known to cause SLE as a side effect. So this is just an normal mnemonic. You can create your own mnemonics. So just remember that most of the molecules that are metabolized by acetylation reaction, they can cause SLE as a side effect. Now coming to the last part of this video, if you have studied toxicology and poisoning, this is something that will interest you. Always remember that if the plasma protein binding of a particular molecule is very high, and if the volume of distribution of a molecule is very high, this kind of molecules cannot be eliminated through dialysis if their poisoning occurs. Once again, if a molecule has a high plasma protein binding, if a molecule is having huge volume of distribution value, if the poisoning of that medicine occurs, they cannot be eliminated through dialysis. So these are the medicines or the poisons that are written here. If the poisoning happens in your body, only antidotes will work or supportive care will work. Dialysis will never work. So to remember the code is avoid dialysis. A stands for amphetamines. V stands for amphetamines, you know very well. They are agents of drug abuse and they are also used in narcolepsy. They are used in children for attention deficit hyperactivity disorder. And before it was used for weight reduction also. V stands for verapamil, which is a calcium channel blocker. O stands for organophosphates. You know very well, these are pesticides and a lot of poisoning reports has happened because of it. Opioids, you know very well, they are usually used in pain management. I stands for imipramine. Imipramine is a tricyclic antidepressant. D stands for digitalis, which is digoxin that is used in the treatment of heart failure. And the D of dialysis is diazepam, which is a benzodiazepine. And you know very well it is used in literally a lot of conditions. So this is another mnemonic to remember the names of drugs. There are literally a lot of drugs that cannot be eliminated by dialysis. This is just a small mnemonic that I got from a book. I just thought I will share with you. So that's it for now. I hope you like this small video. I know it's not actually small, but if you want any information regarding this medicines or anything